When is the right time for hearing aids?
We'll answer that question today.
Take 62.
Welcome everybody, I'm Dr. Michael Squires.
And I'm Dr. Carly Squires.
And this is Dr. Squires Squared.
This is a channel where we have candid and casual conversations about anything and everything audiology.
And if you're not sure what audiology is, make sure to like and subscribe to this channel, hit our notifications bell so that you can keep up with all of our new content, and we'll tell you all about it. Okay, so when is the right time to treat your hearing loss? When is the right time to get hearing aids? That's a really tough question, and one that we get pretty often.
Yeah, we have people ask us that a lot. I'd say that a lot of the times people will say something like, "Well, is it bad enough to treat? Can I wait? Can I put this off?" Is a very common thought.
How long can I put this off?
Yeah, and to that we always explain anyone's hearing loss. There is a range of normal, or a range where your hearing will fall within that normal hearing sensitivity, and that range does not change with age. So as we get older, that normal level doesn't get worse and worse and worse.
Right.
A hearing loss is a hearing loss is a hearing loss, no matter how old you are.
Yeah, exactly. And that kind of plays into the point of, okay, so I have a hearing loss. Is this bad enough to actually do something about? Well, and some of that is what we dive into when we counsel or when we talk about the history of the patient's hearing loss. We have many patients with more significant hearing loss who don't notice difficulties, although their family might.
Right.
And that there's a whole nother reason to treat those hearing losses. Then we have patients that essentially have normal hearing, but struggle significantly in crowds or background noise or with any type of auditory processing. So the treatment for those patients are uniquely, I think, tailored to the patient's needs, and kind of what those consequences may or may not be based on their hearing loss.
Yep, so we like to individually look at each person's hearing loss, but also what difficulties they're having, because that can dictate the treatment. Another thing that you mentioned is just that there are people that we see that have a pretty significant hearing loss, like a lot of hearing loss there that they didn't realize was there. And I like to talk about that too, because our brain is so amazing that it can compensate a lot of times for that, to where it to the person, it's really not noticeable.
Right, it's that same concept that we've talked about in previous episodes of the frog in the boiling water. And for those of you who haven't watched every one of our videos, do it. There's a saying that if you put a frog in a pot of water and then bring that water slowly up to boil, that frog's going to boil alive, because it doesn't feel the changes because it's happening so gradually. But if you take that frog and drop it in boiling water, it's going to try to get out of there. Hearing loss is very similar to that, and the brain adapts so quickly and compensates so well that when it happens so gradually, as many hearing losses do, to the person who has the hearing loss, it may not have the same type of effect or effect on the life anyway as it does to those around them.
Typically we see that the hearing loss is more noticeable or noticed first by family members. Another question that we get asked is, okay, I have a hearing loss, you're telling me that hearing loss is there, but I think I'm going to wait because I'd rather not be dependent on these devices right now. I'd rather put this off so that my brain doesn't become dependent on hearing aids. Yeah,
and to that I say, you're depriving a sensory system, which is never a good thing to do.
Right.
You'll get dependent on hearing aids. I've said this before, like you'll be dependent on your shoes. We can all take our shoes off and go walk around outside, but I promise it'll be a lot easier if you strap on a nice pair of shoes. It's the same thing with your hearing loss. Many of us with hearing loss can struggle through our lives, kind of dealing with each situation or putting it off or blaming other people. But I promise it's a lot easier when you can hear and understand when your hearing loss is treated appropriately.
Absolutely. It just makes things easier. And I mentioned this in a previous episode too. So this is kind of overlapping information, but you do want your brain to become dependent on that because you want your sensory system to be stimulated with that sound. And so the sooner you do that, which kind of segues into our next topic,
right.
The sooner you do that, even if that means you are becoming a user of hearing aids for the long term, which is what that means, that is so much better for you, your health, and your brain, and it's going to put you in a better position to communicate it more effectively when you're 80 or 90 years old.
Yeah, absolutely. So kind of exploring what Carly was just talking about, I use the phrase, if you don't use it, you'll lose it, very often in practice. And it's in direct reference to the brain's ability to understand speech. If we don't use it by either having normal or near normal hearing or treating the hearing loss that we have, if we don't stimulate the auditory system and the temporal lobes of the brain that are responsible for receiving, processing, and forming memories around speech, our brain will figure out new neural networks and it will do something else with that. What we often see is, like Carly had mentioned, we often see older adults who have waited too long to treat the hearing loss. And by the time they come in and make the decision to do something, their brain's ability to understand speech has essentially degraded to the point that even if they do treat the hearing loss, they will never be as successful as they would have been if they treated it 10, 15, 20 years earlier.
Yes, yeah. Your outcomes, your expectations, the success that you're going to have with hearing aids is actually much better the sooner you treat your hearing loss. And sometimes, life happens and maybe you don't realize you have a hearing loss until you are a little bit older. But, you still want to treat that. Just because you're older, an older adult, and you think, well, I'm not going to do well anyway. You don't want to do that. You still want to treat the hearing loss. But we're just saying it does set you up for better success the sooner you do something about that hearing loss.
Yeah, and kind of in summary, there's no bad time to treat your hearing loss, because you can always improve from where you are, but there is a better time to treat your hearing loss, and that's sooner rather than later. Absolutely. You would like us to cover in this episode, we're going to just go ahead and mix up this.
No.
All right, everybody, thanks for joining us for this episode. Just to kind of summarize it up, don't wait too long to treat your hearing loss. There's no sense in waiting to treat a medical issue if you know that it's there. Make it easier on yourself and the loved ones around you. And do yourself a favor and treat your hearing loss sooner rather than later, because your long-term outcomes will be so much better.
Yes. Yeah. So thanks everybody for joining us today. And if you have questions about this, comments, or additional topics that you'd like to hear us discuss, please let us know. Comment on this video. Go back and watch our other ones. Send us an email at info@hearwv.com, or you can call our office at 304-428-2403.
Make sure to like and subscribe to this channel. And until next time, see you guys.
Thanks.